Welcome back to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
And we welcome you back to Talk of the Town for this Monday, June 14th. I'm Gary Stevens. It is the second Monday of the month, which means at this time we catch up with what is going on in the state legislature with the lady that represents most of Allegan County in the State House, third-term Republican House Representative Mary Whiteford. She joins us via the Zoom connection this morning. Mary, good morning and welcome back to WHTC.
Good morning, Gary. Good morning, everybody.
Glad you are with us. If you have a question for Representative Whiteford, she'll be happy to answer it at 616-395-1450, 616-395-1450. There are some things we're going to touch base with you on first, Mary, and a bill improving access to mental health care was signed into law last week. Tell us a little bit about that particular piece of legislation.
Yeah, so everybody knows, I think, I had been working for over 3 years to get the Michigan Crisis and Access Line signed into law. Well, prior to that, I had a bill signed into law to establish an inpatient psychiatric bed registry, which is basically every single psych bed throughout the state. So to simplify things, we had one bill that makes the psych bed registry be a part of MyCal, Michigan Crisis and Access Line. And then the second bill, it was actually two bills, just to make sure the implementation process was going to go smoothly. So it was perfect because it's 2 months after the Crisis and Access Line went live in the Upper Peninsula and Oakland County. And I was able to bring attention to that during this process. And as we're sitting here, I've got some data too. So those two areas were chosen because they were willing to be part of this first pilot. And in a 2-month time, they had 9,269 calls. So nobody had ever heard of this bill before or this line, and the ability to help them. They're already starting to reach out and get help. And it is the only one in the country because it actually includes every local provider so that there's no wrong turn when you ask for help.
Now, part of what was signed was that legislation, but there's also some other bills that you testified on earlier this month about improving Michigan's behavioral health system. And again, another aspect of what you've been very, shall we say, passionate about as well.
Yeah, prior to serving, I was on my local community mental health board, which I had never heard of. And I'm not sure if, I think most people haven't heard of community mental health. But if you think of somebody who has severe mental illness, like schizophrenia, or our forever children with Down syndrome or other brain injuries, like my uncle had when he was born, they can never be independent. And there is a system set up for those who are on Medicaid to help them to stay home safely versus years ago when they were institutionalized. And this is actually a $3 billion carve out, it's called, of Medicaid. So people have their health care, and then this 30,000 people part of our state are under this silo just to help them stay in place. So that's community mental health. When I knocked on doors in Allegan County, I found so many people who worked for our CMH and cared for their neighbors, cared deeply. But as I was on the board, and then I found about regional things and all the different layers of administration, I realized that the focus was not so much on the people who are taking care of our neighbors, but it was more on all these rules and regulations and oversight, but all that was administration when there's a way to streamline this. So what my bill does, it's a 5-bill package. It does a complete streamline. It makes sure that the people served have the rights to make their own decisions. It's making sure that we're not putting all these different risk corridors and things that are just so complicated, so the money's streamlined to the person and our local CMHs and get rid of all those other barriers and administration that's higher up. And I really believe I've worked on this for 6 years. I've got some people that are very familiar with the law that helped me rewrite it. So it's a major change. It's a generational change to how we do this. But now to make sure that We get all the tweaks out. It's a legislative process. And so we had a hearing 2 weeks ago. We've got a hearing this Thursday. I'm going to spend all the summer on a tour going around the state, listening to people who understand and care about this system, and just make sure that we're going in the right direction with this. And so it's a big thing. But I just think about my uncle, who's 70 years old. He's been disabled since he was born. He doesn't make eye contact. He shuffles when he walks. He's completely incapable of taking care of himself. But he got into this group home about 10 years ago that had an art program. And you should see the artwork that he has. I have got 4 of his pieces in my office now, and it's amazing. So I want to make sure every person has their own best life. And that's what I'm working on with this package.
How much has the outbreak over the last 15 months sort of exacerbated this issue, and maybe it has heightened it in terms of maybe more people involved, but also heightened awareness of this particular issue?
So we have that population, and I'll give an example of my uncle. During that year and during COVID and the lockdown, he stopped painting and drawing, completely stopped doing the thing he loves. And so he's starting to come back now that things are open more and people are feeling safer. But I think the biggest increase in problems that we have is this mild to moderate part of people. And it sounds, there's severe, which I talked about, Uncle Al, and severe mental disorders, but there's also people who are on the fringe. And many of those are our children who didn't have those connections while they were at school. Maybe they were with a family that was just so stressed or challenged, or didn't have the tools that they needed to help those kids during getting their online education. The rate of suicide is way up. I was really honored to be invited last week to kind of a brainstorming session in Holland for a new facility on 6th Street for students, 12 to 18 years old, a walk-in center with professional help, but a caring environment. And that's where I'm so proud of Holland and West Michigan. We've really upped our game. And it was really being led by a father whose son took his own life. We have got to stop these children feeling so helpless. And even the 23-year-old person I know last year took his life. And so that's why between the crisis and access line and making sure our local community mental health organizations can help people, we just have to keep upping our game on that. Crisis stabilization units, we talked about that last month. We're able to have those as freestanding facilities all over the state. And I'm finding out that many of them are building them right now. It was really nice. I got a chance to talk to Gretchen Whitmer last week, and I thanked her. I couldn't do this by myself. She signed off and she trusted the process and the work that I did on these bills. And only working together can we really be most successful and most respectful of the people of our state.
616-395-1450. Let's get to a call. Good morning. You're on the line with Representative Mary Whiteford.
Good morning. Kudos to you for your work for mental health. And as a nurse and as you're on different health committees, I am a homebound veteran and have been trying to get a COVID-19 vaccination shot. When I first called the health department, they blamed the state. The state, of course, blames the federal government on not getting when the vaccines were not getting out. And I'm calling in consideration for the people that are homebound. I do have a wound nurse coming in, and her agency has not been given vaccinations to give. Supposedly, there's someone contacting me this week, but the coordination between the state and the health department, and at least I don't know how many are in the population that are at home, has not been good.
Thank you for bringing that up. It seems like everybody always blames each other, right? So if you can call my office, let me talk to some people and make sure that somebody's able to come to your home and get you that vaccination, okay? And the number is 517-373-0836.
Just
and whether
repeat it
you're
one
in
more.
Ottawa County
Yeah.
or Allegan County, we'll help you navigate that.
Mary, can you repeat that one again, the number?
Absolutely. 517-373-0836. Thank you.
Okay. So hopefully that'll help.
Thank you.
I appreciate the call. 616-395-1450, 616-395-1450. Mary, I'm going to play this. We had this produced over the weekend by our Greg Chandler, and it ties in before the caller to what you were talking a little bit about, dealing with suicide and with the American Federation for Suicide Prevention.
This is Greg Chandler, voice of high school and Hope College sports on WHTC and 92.7 The Van. I am also a suicide loss survivor. I lost my daughter Lindsay to suicide in November 2017. I will walk in her memory on Sunday, September 19th at Millennium Park in Grand Rapids at the American Foundation for Suicide Prevention's Out of the Darkness Walk as we remember those we have lost and fight to save those at risk. You can make a difference. For more information or to sign up, go to afsp.org/Grand Rapids.
Wanted to play that for you and for our listeners as well. We just had this produced over the weekend by Greg.
Yeah, Greg and I have had conversations about this, and we've always gone back. Why? What's that trigger? What's the ultimate thing we can do? And that's really where the crisis and access line came into play. When somebody reaches out, we have to help them that first time. Otherwise, they think there's nowhere to go. And as we start getting more providers in there, more connection, I just pray that we're able to catch people sooner than later, because, once that gun fires, once that rope goes, there's no second chance. So it breaks my heart. So I'm so glad that Greg was able to bring his personal experience and try to make a difference.
Mary, this next topic is more in line with the person that we'll be chatting with a week from today, State Senator Eric Nesbitt of Lawton, who drafted the legislation a couple of years ago about the auto insurance reform situation. Another phase of that takes effect at the beginning of this month, and you issued a statement last month about response to questions about the implications of the auto insurance reform. We're starting to get some people saying, hey, maybe it's not all it's cracked up to be, and maybe you tried to set the record straight on this.
Yeah, I appreciate that. So I had conversations with the writer of the editorial, whatever we want to call it. I had conversations with her, and then I got in touch, and I'm like, who's your home care agency? Where's our disconnect? I want to find out the facts that's going on. I actually talked to the CEO of that company, and he was so frustrated that there's companies out there scaring clients. He's like, I'm not going to totally abandon that person. And it's very frustrating. And he had conversations after that. I'm not going to abandon you. I'm not going to abandon you. There's just companies out there that are causing so much fear and turmoil. And like the CEO of that home care agency said, we need to work through it, figure out there was no intent to have people left high and dry, and have some follow through. So we're working on this every day to make sure that this is a smooth transition, people aren't left alone, and that the funds that were set aside for individuals who are injured that have lifetime benefits owed to them are really taken care of. And so I'm just like, let's calm everything down, make sure we've got things covered. We're working very closely with our legal team to make sure that this doesn't happen. And there's companies who said, we're not dealing with this, and they got rid of all their clients. And guess what happened? Another company said, we'll take care of you because we know it's going to work out. So it's a lot of drama. I just say, if people have questions, reach out to my office. I'll get in touch with their companies, figure out what's going on, and then we'll make sure that people aren't left the way that this scare is going.
Now, and I can't, right now I cannot access the full MERS News report on this. I can just only give you a headline. The president of a West Michigan-based home health care provider said he's personally aware of 9 Michigan facilities that will close their doors for good as of July 2nd in reaction. that 2019 auto insurance law designed to cut rates for drivers. Is that also, a little drama? Or, again, I don't have the full story, Mary, so I really can't relate the whole thing to you. I'm sorry.
That's why it's really hard to navigate this when politics get involved and people are throwing bombs. We had the most expensive insurance in the country. And there's a lot of bomb throwing on. There were a lot of people making a lot of money. That's why I go straight to the companies. What is going on? And so we can get beyond all these headlines. So I don't know what that person's saying. I'm not sure if they're just trying to get the legislature to act on something, but I'm sorting through. Just like, unfortunately, when politics affect people's lives, especially those most vulnerable, it's shameful. So let's just get to the heart of things and figure it out together.
By the way, Mary, I was able now to access the story. Frantic families are calling Chris Scogan, president of AdvisaCare, and his team about availability as his facilities for their catastrophically injured loved ones after they received a 30-day notice from their current provider that they'll be ending services. And the comments came a day after Representative Ryan Berman, a Republican from the suburban Detroit area, Commerce Township, introduced House Bill 4992 to change reimbursement rates for providers based on regional market averages as calculated by the State Department of Health, of Insurance and Financial Services. So again, it looks like, again, try to straighten this mess out and try to provide service, but also make sure that rates are fair for all students.
Absolutely. So every day I go back to session tomorrow. I've got meetings all afternoon. And so I'm just going to stay on top of this every single day because things change.
One other thing, Mary, and then we'll button up our conversation. Last month, I believe it was last month, Governor Whitmer had a meeting with the leaders in the House and the Senate. I call it, burying the hatchet, not in each other's pointed heads, but past the peace pipe, sort of an agreement where there'll be more cooperation between the legislature and the administration. The administration will be brought into the budget making process. Have you seen any aspect of that coming forward over the last month, or is it just simply a good PR move by the administration and the leadership, and there's still some issues between the two branches of government?
I know that there's conversations going on. A really good sign was when Governor Whitmer reached out to me for a personal bill signing. We all care. There's a lot of money out there that needs to be appropriated. We have a big budget. My budget, I think it's going to bloom from $26 to $31 billion. And then we've got billions of dollars of federal money coming in. So I'm very hopeful. I know the governor wants to make sure it's spent properly. I'm really pleased. I'm not sure if I announced this earlier, but I think it made it to Holland Sentinel, is a huge investment in infrastructure for mental health, from a pediatric psych hospital to adult beds around the state, pediatric beds, crisis beds, PRTF, psychiatric residential treatment facilities. So for people who don't need full inpatient admission for psychiatric issues. So all these things, even $20 million to increase the number of school-based health centers where kids can get the help where they are at school. So I'm very hopeful. I know that Governor Whitmer wants to do a good job, and we all want to work together to get this done. It's just been a very difficult time, but I think a lot of learning has happened over the past 2 years or 3 years, and I'm going to just keep focusing on things I can control.
Yeah, hit the wrong button.
It's like, stop talking, Mary, you're done.
No. I was trying to I should have potted that down because we're out of time. I apologize for that, Mary, but I certainly appreciate the time. And for the most part, we talked about some positive things going on in Lansing, and hopefully we can continue that as we continue over the summer months. Mary Whiteford, thank you very much for joining us this morning on Talk of the Town. If all goes well, let's do this again in July and hopefully get all the glitches out of the way too.
Okay. Thanks, Gary. Thanks, everybody. Have a blessed day.
Thank you very much, Mary Whiteford on 99.7 and 1450 WHTC.